So starting with the interscalene approach of the brachial plexus, the interscalene approach is being used for the surgeries of shoulder and arm, and postoperative analgesia for total shoulder arthroplasty and surgeries on the lateral clavicle and the acromioclavicular joint. The contraindications being patient refusal and local anesthesia allergy, and bilateral blocks in case of patients with compromised lung can lead into bilateral phrenic nerve palsy and then respiratory paralysis. So in the interscalene approach of the brachial plexus, the high frequency probe is being placed at the level of the cricoid cartilage, which corresponds to the C6 spine in the posterior cervical triangle. So in this approach, you will be seeing the roots C5, C6, C7 in the interscalene groove, which is being formed by the anterior scalene and the middle scalene. So most of the time the C6 will be bifascicular, that's why you are able to see two hypoechoic structures. And there is an hypoechoic structure just anterior to the C7, which is nothing but the vertebral artery. The other structures which has to be considered in this approach is the phrenic nerve. The phrenic nerve moves on the surface of the anterior scalene, and you can see two more nerves within the substance of the middle scalene, that is a long thoracic nerve bill and the dorsal scapular nerve. So in case of in-plane approach for the interscalene groove block, these two nerves might get injured. The next approach is for the upper trunk block. So the selective upper trunk block has been performed in order to avoid the phrenic nerve. So this block is performed more distally in the interscalene groove, and this involves the upper trunk, which is being formed by the C5 and C6, which forms the most supply for the shoulder. So and it is being used equivalent to the clinical effect of the interscalene block itself. And the advantage is that it avoids the phrenic nerve and it requires a very small volume. Okay, here you can see the superior trunk being formed by the C5 and C6, and you can see before the trunk divides into anterior and posterior division, you can see the suprascapular nerve moving away from the trunk. So this is the ideal spot for giving a selective superior trunk block. So how to identify the C5 and C6 and C7 roots, which is very important to perform this selective superior trunk block, is in case of C5, if you trace it in a cranial manner, you will be able to see the nerve moving between the anterior and posterior tubercle, whereas the C5 tubercles are equal, both anterior and posterior looks similar. Whereas in case of C6, the anterior tubercle is more prominent, whereas the posterior is better rudimentary. And this anterior tubercle forms the Chesegnac's tubercle. And in case of C7, there is no anterior tubercle, and only the posterior tubercle is more prominent, and you can see the C7. So in this identifying the roots, the C6 nerve root passes between the anterior and the posterior tubercle, and you can see the prominent anterior tubercle, which is called as the Chesegnac's tubercle. Whereas in case of C7, there is only the posterior tubercle, no anterior tubercle, and you can see the vertebral artery anteriorly, and behind it is the